Good morning. I am Sabrina Horn, Well Woman Nurse Supervisor.
And I am Katie Campbell, the Well Woman Nurse Coordinator. And we're going to be going through the Well Woman protocol, just an overview. So we'll go ahead and get started. This is just an outline of the presentation, the information that we'll be going through this morning. This is an overview of the Well Woman program as a whole. It is a preventative health screening program for women ages 15 to 55 in Alabama. The program provides access to preventative health screenings for cardiovascular disease, wellness checks, and vision and oral screenings. The program offers free services to address issues with obesity, hypertension, high cholesterol, and diabetes.
Program summary and provider responsibilities. Well Woman goal. Our goal as a program is to provide preconception and interconception care to women of childbearing ages as a foundation for wellness, identification of chronic diseases, and planning to adopt a healthier lifestyle. We encourage referrals from community partners, physicians, and other ADPH programs like family planning and STD. Our mission is to provide healthy living, prevention, and early detection of diseases, and to increase the quality of life for women ages 15 to 55. The program enhances access to preventative screenings for cardiovascular disease, annual wellness checks, and vision and oral screenings. We also focus on counseling before and after pregnancies to improve birth outcomes in the state of Alabama. Well Woman enrollment. Our ideal participant is the uninsured and underinsured, but we will not deny services to any qualifying participant. All eligible participants can enroll in the program at the local county health department, which offers Well Woman services. An eligible participant can enroll in the program if she's age 15 to 55 and also resides in that county where ADPH Well Woman services are offered. Enrollment is initiated when the participant consents to Well Woman services after signing the consent form and consents to preventative health screenings done by the nursing staff at the county health department. The visit is noted on the clinical encounter form and documentation of lab screening results done in the electronic health record. The program provides reimbursement to the Well Woman counties for lab services. To receive reimbursement, please provide central office staff with a copy of your clinical encounter form by the end of the month. Informed consent. A new consent form must be signed at the annual rescreening visit. Verbal consent at the time of an annual rescreening is not acceptable. Yes.
Screening guidelines and management. This is an overview of the Well Woman visit. The program offers services to women ages 15 to 55 who are currently ADPH clients or are referred for services. The following things are part of a Well Woman visit: preconception and interconception health planning, risk reduction counseling, health coaching, and vision and oral screenings. A baseline screening visit. During an initial or annual Well Woman visit, a baseline screening is performed. This screening is done by the clinic aide, the registered nurse or nurse practitioner, and documented in the electronic health record. This consists of 2 blood pressures with a calculated average, cholesterol and blood sugar check, height, weight, BMI, vision screening, and waist and hip measurements. And then participants over the age of 40 will also receive a calculated 10-year cardiovascular disease risk assessment by the registered nurse or nurse practitioner. And then participants less than 40 years of age will receive cardiovascular disease risk assessments for cardiovascular disease, type 2 diabetes, and kidney disease. These are also some more information from the baseline screening visit. Participants will be provided with these results, and then we'll have a risk reduction counseling meeting with the nurse practitioner. This is information regarding the vision and oral screening. This will be done at an initial visit. The vision screening will be done using the Big E or the Snellen chart. Results for each eye should be documented in the EHR, and then visual complaints should be noted and referred as appropriate. Oral screenings will also be done as a part of the physical exam and documented in the health record. If there are any suspicious lesions or caries, these should also be referred as appropriate. Risk reduction counseling should be done by the nurse practitioner. The participants will meet with her or him to review medical history, healthy lifestyle assessment, labs, and clinical results. They will also review the baseline risk reduction data in the health record. The nurse practitioner will review diet and the participant's ability for physical activity. If needed, the nurse practitioner will complete the clearance participation form. This form is located in the letters section of the electronic health record, and the participant will be provided a copy of their record and referred to the social worker to continue lifestyle and health counseling.
Social worker follow-up and healthy lifestyle support management. The social worker is the driver of the program and responsible for case management of the participants. She coordinates health coaching sessions and support group meetings, and also reinforces education provided by the nutritionists and or the NP. The ADPH Well Woman social worker consults with the Well Woman participants to assess readiness to change, provide health coaching, schedule follow-up visits with a nutritionist, or to address any other identified problems such as smoking or providing resources for physical activity. The initial social worker visit will be face-to-face. After the initial visit, the Well Woman social worker must conduct 2 follow-up social worker visits and a 7-month follow-up visit. The ADPH Well Woman social worker consults with the Well Woman participants to assess readiness to change, provide health coaching, schedule follow-up visits, and visits with the nutritionist or follow-up visits with the NP. Educational opportunities, support, and health coaching sessions will be provided by the Well Woman social worker and the Well Woman nutritionist via phone, virtual means, and other means that allow for compliance with the program, CDC guidelines, and recommendations from the state health officials. The program offers free home blood pressure monitors to qualifying participants. Eligibility for the home blood pressure monitor will be determined by the screening provider, and the monitor will be issued to the participants after signing the blood pressure monitoring agreement. The Well Woman program utilizes the New Leaf curriculum, which is a nationally recognized scientific-based intervention tool that emphasizes practical strategies for making changes in dietary and physical behaviors. All Well Woman participants receive a New Leaf booklet on the initial visit. The program provides 1 to 2 nutrition classes with a registered dietitian after the initial visit. The purpose of the nutrition classes is to provide science-based nutritional information that supports healthy lifestyle habits and teaches strategies on how to implement behavioral change. Patients are given the opportunity to participate in those nutritional classes with a variety of topics which address sugar and salt intake, food choices and portion control, benefits of physical activity, and smoking cessation.
Well Woman Visit Standards. This is information regarding the initial or annual Well Woman visit. The purpose of this visit is to determine eligibility based on age and review and obtain the informed consent for services. During this visit, there will also be labs obtained and then information to complete the baseline and risk reduction data. Counseling will also be provided to address patient concerns or provider-identified needs. Monthly breast self-exams and annual complete breast exam will be performed. Mammograms and any cervical cancer screenings. Preconception and interconception plans, abnormal cardiovascular risk factors, and the importance of follow-up if abnormal screening results are reported and additional treatment referral is needed. They will also counsel on abnormal vision and oral screening findings. The Well Woman revisit might be indicated for an established Well Woman patient for reasons such as problem-focused visit, follow-up assessment of hypertension, or an abnormal finding from a previous visit. During this visit, a review of current eligibility status and consent should be signed for services. The RN will review data collection and update the form as needed. Perform lab screening if indicated and document this information in the EHR. Document the purpose of the visit and provide problem-focused assessment and counseling. The Well Woman telehealth visit. Telehealth services can be provided by the ADPH nurse practitioner via phone to Well Woman patients with verbal consent for audio interaction. Telehealth visits should be conducted after the completion of the initial visit and scheduled as a revisit. Telehealth visits should not be used for any condition where an in-person exam is required, and the nurse practitioner can use professional judgment to determine when telehealth is needed. These are just the guidelines for telehealth. You want to create a space for visits to ensure privacy, review the participants' records for eligibility, the data collection form and clinical assessment, lab results, reproductive plan and medical history, and then update any changes in the electronic health record, initiate treatment and follow-up for identified issues, refer to the social worker for health coaching or the nutritionist for nutritional education, document the visit, and then in the encounter form, enter for COVID response.
Thank you.
Thank you.